Hello, Dr. Mark Ashipari here. Today's episode of the IDRiM podcast, for those watching on YouTube, will notice that there will be no video clips of us three speakers talking. That is because of connectivity issues regarding our speaker, and if we had videos on, we would have lost the speaker. Therefore, it was decided to record this with just the audio only. We're sorry about that, and we hope that next week we'll be back to you seeing us. I hope you enjoy today's episode. Hello, everyone, and welcome to the 21st episode of the IDRiM podcast. This week, we will be kicking off a special Pride Month series where we'll shine the light on the experiences and challenges of the LGBTIQA plus community in disasters and emergencies. So, give a bit of context. Pride Month, observed every June in many parts of the world, is more than a celebration. It's also a commemoration of the struggle and a tribute to the courage and a call of action. It begins in the honor of the Stonewall Uprisings of 1969, where gay and trans people stood up against violence and systematic injustices. Since then, Pride has grown into a global movement advocating for equality, safety, visibility, and dignity for people of all sexual orientations, gender identities, and expressions. The LGBTIQA plus acronym represents a diverse community of lesbians, gays, bisexuals, transgender, intersex, queer, or questioning, asexual, and the plus also acknowledges that there are many other identities that exist beyond these labels. So the community is not a monolith, it's made up of different distinctive stories, needs, and strengths. Yet when disaster strikes, whether it be natural hazards, pandemics, or conflicts, these identities often amplify vulnerabilities. Barriers to access and aid, unsafe shelters, discrimination from respondents, invisibility in data, and also the erosion of chosen families are some of the challenges that the community face. Today, we'll explore some of these issues with someone who's at the forefront of the inclusive research community, Mr. Kevin Blanchard, who is the director of DRR Dynamics and is also a tireless advocate for equality, diversity, and justice in disaster risk reduction and response. Kevin has worked internationally to elevate the voice but are often unheard in disaster policy and practice. So welcome, Kevin.
Thanks very much, Mark and Harris. It's a pleasure to be here. Thank you.
Thanks. So first question, what drew you into the intersection of the LGBTIQA rights and disaster risk reduction?
I guess the answer is I've always been really interested in how those who are kind of at the fringes of society, and whether that be queer people, LGBTQI plus people, or whether that be refugees or asylum seekers, sex workers, etc. I've always been interested in how they intersect with policy and practice during disaster, before, during, and after a disaster as well. So I guess it's kind of a natural progression for me to turn my focus to this particular community. I identify as a gay man myself, so putting myself in the position of someone who would be impacted by a disaster, I often wondered how my relationships, my family structure, how I present myself, how I speak and act may cause issues within a disaster context, and that I think is a really interesting question. And it's something that it's not just myself who's been doing work on this particular topic. There are many people around the world who are focused on the idea of gender and sexual minorities in disaster risk reduction and disaster risk management. And we are trying to better understand that so that when a disaster does happen, we are better prepared and we're better able to advocate for our community and ensure that those community voices are heard at the highest level and are able to impact policy and practice.
So, thanks, Kevin. So, in that matters, do you think that the LGBTQA plus people is already being included in the disaster response policy, or there is still some gaps on that?
I mean, there's very, very little inclusion. In fact, I did a piece of research back in 2019, I believe it was, where I looked at the disaster legislation found globally. I looked at every single country's disaster risk reduction focus legislation and disaster management legislation, and searched for any mention of gender or sexual minorities. And unfortunately, I only found 6 examples of that on a global scale. Of those 6, only 2 were UN member states, and the rest were city-based legislation or local authority-based legislation. So at a national level, when we're talking about national disaster risk reduction, national central governments, there's no mention. There's just, apart from those 2 countries, there is just no discussion happening around this topic. So I don't even think we can say there are gaps. I think there probably needs to be a much wider basis of research, of understanding of policy, to be able to say there are gaps. What we're experiencing and what we found during our research, both my own personal research, the work I do in DRI dynamics, but also the work I'm doing with other people interested in this topic, is that this lack of understanding by policymakers and by emergency responders and practitioners within this field is having a real impact on how queer people and gender and sexual minorities are able to access basic things like shelter, like food and water, how their family structures are recognised and considered when they're seeking help from emergency services. So it really is. We are at the very beginning of this journey of trying to ensure that this is mainstreamed, ensuring that people of diverse gender backgrounds and of diverse sexualities are better understood, and how they operate during disaster situations.
Yeah, and actually, I'm surprised when you said it was just 2. By chance, which 2 are we talking about here?
So it was actually this is. I should have looked at this, but I believe I think it's Sweden and Ecuador over in South America. So they're and again, and this is I think the complex discussion around here, because around this particular topic, is because I would imagine now that Ecuador may have kind of reevaluated that policy, and based on a change of government, based on a change of kind of cultural background, etc., within each country around the world. We can see an erosion of the rights that had been, as you mentioned, Mark, in your introduction, that had been gained over the decades. And of those 2 countries, Sweden and Ecuador, both have recently voted in right-wing governments, who may have slightly less welcoming or open positions on gender and sexual minorities in society in general. And when you kind of attach a disaster to that hostility or to that discrimination, you find that those levels of animosity increase, because disasters are very stressful for every single person in society. And if you have a protected characteristic, or if you have a characteristic that's outside of the mainstream, then that becomes even more stressful. So it's a really interesting piece of work in terms of trying to understand where we are at a global stage, but these things are so fluid. So in 10 years' time, hopefully, I would hope that we've gone the right way in terms of greater recognition and greater understanding of this particular topic. But alternatively, we could have gone the wrong way, and we're in a society that doesn't consider marginalized groups, doesn't consider anyone who sits outside of the mainstream as easily and as readily as they do now. So it's very complex, and it's constantly changing and constantly flowing and kind of going back and forth. So yeah.
Well, it's interesting you mentioned Sweden as the place I live in right now, and as you mentioned that the change of government also influenced the policy,
Yep.
especially in the futures regarding the what do you call it? The gender minority.
Gender and sexual minorities is the term I
Gender.
use. Yes, yeah.
Yeah. That's and this what I observe is basically perhaps since it's outside the mainstream, every country has its own definitions and how its own view regarding the minority, what is considered minority, what is how many groups actually involved in this, and do you think that it needs a universal understanding and universal perhaps definitions in order to make many countries to have this kind of inclusivity in the policy, or they can just define by themselves and develop their own policies?
Yeah, I think it's I mean, terminology, as we all know, via the No Natural Disasters campaign or the other kind of discussions we have around the disaster risk reduction sector, terminology is incredibly important when it comes down to disasters. In terms of how we respond and how we recover, who we look at, who we focus our attention on, etc. So terminology is very important, but my concern with having kind of a homogenous definition or understanding of what constitutes a gender or sexual minority is that there are so many variations, as Mark pointed out in his introduction at the beginning. There are so many variations, and it's very cultural and it's very regional as well. And I did a piece of work back in 2022 with University College London, where we put together a reference guide looking at the topic of gender and sexual minorities in disaster risk reduction to understand kind of what literature is out there, what the gaps are, etc. And we had an initial meeting, myself and people like Maureen Fordham and Olivia Walmsley and others who were engaged with this process, trying to understand what terminology we were going to use, what names, what acronyms we were going to use to define the people in the communities that we were looking at. And in the end, we had to admit that there was no simple way forward. There are so many different terminologies and names and local contexts and differences within how one country or one region views these communities, that it was impossible to try and cover everything. So I think, say, for example, if tomorrow the UNDRR decided they were going to come out with a standardized terminology for this community, I would probably push against that. I would lobby against that decision, because I think you risk erasing viewpoints that would be missed because maybe they aren't kind of well established within their country or within their community as an organization, as a kind of an organizing group, as a group that can advocate for themselves. So you risk kind of missing viewpoints if we have too narrow a definition of what it is that we're looking at. But I do take your point that it would make it easier for policymakers to introduce this, and that's why I use the term gender and sexual minorities, because it's really a kind of a catch-all term, and does cover hopefully as many people within this community as possible.
Yeah, I completely agree, because I think of when I was growing up, it was just LGBT, and that was it, and that didn't include a lot of the other bits, which I'm glad the new acronym does include more of the other bits into it, which is important to recognize, especially when we talk about asexuality. It's one of those ones that no one wants to talk about, because some people view it as a bit strange. It's not strange. It's very much it's a thing about people are not attracted to other people, and that needs to be recognized. So just thinking about this as well, what are some of the most overlooked aspects of LGBTIQA experiences in emergencies and or post-disaster settings?
Yeah, I mean, the kind of the frequent ones that are often cited is kind of familial structure. So if you have, for example, two men who are in a relationship, same-sex partners, it may well be that they're married or, cohabiting, and maybe they have a child, for example. When that family unit, and they are a family unit, when that family unit tries to seek shelter in the aftermath of a disaster, unless they have a person, an authority working in that shelter that one recognizes same-sex couples and families, and two, has no kind of discriminatory views against families such as that, you have real barriers in accessing the services and the needs that everyone, every family, every individual needs after a disaster. Access to a shelter, or access to food, or access to funding if your house has been destroyed, etc. And that's one of the main ones that often gets cited. But then also we have got huge amounts of research out there that talk around the levels of discrimination and violence, physical and sexual violence against gender and sexual minorities in the aftermath of disaster. And that obviously has a direct impact on both the families or the individuals themselves who are victimized from that, But then we also have societal issues with that, because you know, that creates and breeds a level of distrust between both the gender and sexual minority community and authorities, if that you know, those actions aren't being stopped or aren't being challenged in an appropriate way. And it creates a level of hostility between the two communities. And what we've seen in you know, disasters such as Hurricane Katrina over in the United States back in 2005, where a huge number of transgender people were either misgendered and sent to the wrong parts of the shelters, the emergency shelters within New Orleans, and therefore were open to sexual assault or physical violence. And what we end up seeing is, you know, these increases in these really horrible destructive acts against a person just because of their gender or sexual identity. So, you know, shelter, physical and sexual and emotional abuse, discrimination, they are kind of the most overlooked at the moment within kind of, you know, an emergency management or an emergency response setting. Obviously, there are lots and lots of other areas that are overlooked, but they're kind of the main ones that we are able to quantify because we have research behind them, we have data behind them.
Yeah, well, in general, the post-emergency settings in the shelters, usually there is some hidden abuse in there, where I found in many cases actually there are also some crimes related, because like they are in emergency settings, and as you mentioned, actually affected maybe more in the gender and sexual minority, because like they are uh, have the tendency to be got the like a bad look in the community perhaps. Well, it's in their terms. Usually, disaster also have a cycle where there are also the risk reductions. You know, the before going to the shelters. Is there any in your experience and your research that the inclusivity of these gender and sexual minorities actually participate actively in the risk reduction measures in order to help themselves and the community to be have a better preparedness against conflict or disaster?
Yeah, I mean, the gender and sexual community as a whole, and again, you know, it's so diverse and so varied that I don't really want to say it's a homogenous kind of response. But if we were to take all gender and sexual minorities as a group, and we were to try and kind of give some kind of understanding or some kind of meaning to how they interact with the kind of the planning and the preparedness phases of a disaster, we have some research that shows that because of a lack of institutional support received by the community, by the gender and sexual community, they are some of the most self-organized and self-prepared community members within society. So a really good example of this was during the HIV and AIDS crisis back in the 70s and 80s and 90s, and particularly in countries like the United States, where they were effectively kind of refused help from central government, from you know, any kind of funding sources at that level of kind of federal level. They ended up having to self-organize and self-advocate and self-care. And we see this time and time again. The Nepalese earthquake in 2015, this really incredible organization called Blue Diamond Society that was entirely at that point focused around kind of, you know, trying to change cultural attitudes around gender and sexual minorities. It was not at all a disaster focused space or a disaster focused organization, but because of that earthquake, they ended up having to shift into a disaster response organization. Now they focus very, very strongly on issues of disaster response and climate change adaptation, etc. So again and again, we see the community, because of this lack of institutional encouragement or kind of support, our communities are very self-sufficient. And one of the ironies of all of this is that we see huge numbers of lessons that queer people, gender and sexual minority people are learning and are able to, you know, recover in ways that others can't. But you know, those in the mainstream of society, cisgender, heterosexual, etc., those working in the emergency response fields often overlook these lessons, and actually these lessons could go on to benefit huge numbers of kind of mainstream society as well. So, you know, there's lots of evidence out there to show that the community is really, really good at self-organizing and self-response. But those lessons aren't being taken on by the mainstream society, and so there's a big gap there. There's a big kind of discrepancy between what's happening on the ground and what policymakers are able to use or even willing to use within their work.
Yeah, and actually about them lessons you were just mentioning here about mainstream, I wonder if the mainstream and governments haven't learnt from the HIV/AIDS crisis and how they attribute diseases towards certain groups. So I'm thinking of the Mpox outbreak in 2022 and how there were there was this narrative that started to build up again that it was caused by, you know, men having sex with men type of thing, and that it was starting to build this homophobic narrative again, that especially in the UK. And you know, I remember talking to a colleague of mine back in 2022, and I said it felt like that we hadn't learned the lessons of HIV/AIDS, where it was a very similar feel, where it was put on one community the cause of this, rather than it's an issue that was going to affect everyone.
Yeah, I think you're right. I think, you know, it did highlight how little we've moved forward. One kind of, you know, I like to think of myself as a glass half full guy. And one thing I think we did learn from the Mpox outbreak was, yes, although there was, I mean, firstly, there was the kind of the homophobia or you know, homophobia attached to the initial outbreak, but there was also racism. You know, the original term of monkeypox was, you know, covered in racist undertones, and had you know, had that kind of gone on unchallenged, I would be less hopeful. What I was very hopeful of was the both the WHO and then member state governments rectifying you know, the kind of the language that they were using around this. And you know, WHO in particular, the World Health Organization, they did a really good piece of work around trying to destigmatize the particular virus, and move the discussion away from the fact that at that time it was predominantly impacting men who have sex with men or gay men or bi men. But you know, it shouldn't be viewed as just the gay, and I'm doing inverted commas here, it shouldn't be viewed as just the gay or kind of homosexual or queer virus. And I think that's something that we've definitely improved on since the HIV/AIDS crisis. You know, that would never have happened back in the 70s and 80s and 90s, but it did happen now. And although you know, it had to happen to rectify a mistake that was made originally, it was still something that was done relatively quickly. So you know, yes, we have huge numbers of lessons to learn, and you know, there's a whole piece of research out there around how queer people were impacted by the COVID-19 outbreak. And you know, how public health officials were hesitant to engage with this community and kind of learn from the HIV/AIDS epidemic from the 70s and 80s. So you know, I think although there's lots and lots of lessons to learn, I do think we are in a slightly better place than we were back then. So I think, yeah, it's kind of glass half full, but also with a dose of reality.
Well, it's interesting that you mentioned that there is racism in there. I mean, in the historical of like the monkeypox history that you mentioned. Now, since gender and sexual minorities is part of the marginalized groups, a bigger marginalized group that also include race and disabled people and others, uh, which groups actually do you think fare better in the current situations, and how each of these marginalized groups can help each other to actually to be with inclusive part on the community in general when in order to get more equal access in terms when the disaster happens.
Yeah, I mean, I think firstly we have to say that, you know, marginalized groups are marginalized for a reason. There's a you know, societal, cultural, historic discrimination that's, you know, found in almost every single part of the world that means that marginalized groups are marginalized. So I don't think any one group maybe fares better than the other. I think every group that's considered marginalized, whether that be someone with disabilities or a person of color or queer person, etc., they all have different challenges and different kind of negative and positive encounters of DRR professionals and DRM professionals. But in terms of kind of how we as communities help each other, I think it's really important at this point to talk about intersectionality, because, when we're talking about marginalized groups, it's important to recognize that, people don't live single issue lives. It may well be that, yes, you identify as gay, you identify as a gay man, but it may well also be that you're in a wheelchair and therefore you have a physical disability that also contributes to a level of extra risk during a disaster process than, say, someone who's able-bodied but also queer. So, this intersectionality approach, which people like Maureen Fordham, who used to lecture at Northumbria, I think she's still an honorary or emeritus professor there, and now is doing lots of work in the field of inclusive DRO as well. They've really highlighted the idea around intersectionality and how people have these overlapping vulnerabilities and capacities that kind of change individual risk and exposure. And I think as marginalized and as vulnerable, and again I'm doing air quotes with the word vulnerable, groups, we have developed large cohorts of shared research, of shared resources, etc., that identify both these interlinkages but also how we can support each other and how we can work together as very different groups of individuals to better advocate for this. And I think you can look at something like the United Nations Office for Disaster Risk Reduction, their stakeholder engagement mechanism, which is basically their kind of informal setting for stakeholders to kind of sit around a table and discuss disaster risk reduction policy and practice at international level. I think you can see just by some of the major groups that sit within that process. So we have the group for women and girls, we have a group for disabilities, we have a group for refugees, we have a group for older people, and just recently it's been announced that there'll be a group for gender and sexual minorities as well. So, and all of those groups work together to really kind of advocate and push for a more inclusive disaster risk reduction and disaster risk management process. So I think, there are differences, but there are also strengths in us working together and trying to develop something that's much more collaborative.
Yeah, when I'm thinking about differences as well, how do generational differences within the LGBTIQA plus community affect disaster risk and preparedness?
Yeah, I mean, of course they as is the case with every part of our society, someone's age or their political views or how they were brought up, or all these kind of different things impact how they are able to respond to a disaster, how they're able to recover from a disaster. One thing I would highlight is older people within the LGBTQI plus community have already experienced the HIV/AIDS crisis. They've already gone through these very, very traumatic kind of defining moments of the queer and gender and sexual minority community, and they have immense lessons that they are able to bring to the table and engage with, and use that knowledge to build something that hopefully is better and is more inclusive and more engaging with those particular parts of society. But also, on the kind of the flip side of that, so younger people, particularly queer and gender minority youth, they have grown up in a world that's they've gone through kind of key periods of their very short lives so far. They've gone through kind of a pandemic, and they've gone through financial crisis, and they've gone through all these different kind of major global events. But they've also had technology that's enabled them to develop ways in sharing information and communicating and advocating for different things that they find important. So, there is a huge difference, of course, between age and how someone responds to a disaster, and that's particularly relevant in marginalized groups. But I think, again, both kind of ends of the spectrum, whether we're talking about very young people or we're talking about older generations, both have very valuable and very worthwhile pieces of information and knowledge and expertise to bring to the table. So I think, again, being a bit more collaborative, opening up channels of communication and opportunities to discuss these things is very important going forward for whatever it is that replaces the Sendai framework.
So would you say that actually social media has actually helped the community in preparing for disasters or hindered in some way?
I think it's a mixed bag, to be honest. I think I can't imagine there's any group actually in the entire world who have benefited from social media. I think social media is a massive force for good, but also it's a huge issue. Is we're seeing rates of misogyny, racism, homophobia, sexism, etc. All these different things because of social media, because these very toxic, very harmful approaches can be kind of widespread and shared more widely than they would have been in the past. But on the flip side, as we mentioned, we've seen social media has enabled us to communicate much more effectively with other people. Disaster risk reduction is using social media very effectively at making sure that early warning systems are shared as widely as they possibly can. I was just in Kyrgyzstan last week doing some training with the Kyrgyz IDRiM organization or agency, and we were talking there about the strength of social media, and if you can get that social media channel activated in a way that's appropriate and useful, it really does open the door to so many more people receiving emergency messaging. And I think when we apply a gender and sexual minorities frame to that, it's again very important. Apps like Grindr or Hinge or other kind of dating apps, they have huge amounts of data and huge amounts of kind of reach in terms of our community, that they were able to share these emergency messages and promote the idea of inclusive disaster risk reduction, because they have this access to a part of society that is traditionally undervalued or underlooked. So I think social media is a kind of a mixed bag. It offers real opportunity for us as DRM and DRR professionals and practitioners, but it also, it provides huge amounts of risk as well, and misinformation, etc. like that is very dangerous.
So, just to give a background to our listeners, today is Monday, the 2nd of June, and it's also the first day of the global platform. And I know you're attending from tomorrow,
Yes.
Evan. What are you looking for in terms of trying to bring a lot more of a light to the LGBTIQA community, and what do you think we should be looking out for?
Yeah, so the global platform, for those who don't know, who are listening, is a gathering of disaster risk reduction, disaster risk management, emergency management professionals from around the world. It tends to be primarily policymakers, those working in government, etc. But also with some first responders as well. And every 2 years we get together at various places around the globe to discuss the sector that we work in, and to make connections and to collaborate and exchange information, etc. This year is happening in Geneva, and as Mark just mentioned, I'll be attending from tomorrow, the 3rd. So in terms of what I would like to see from a gender and sexual minority perspective is the UN DRR just released, or released, I think it was last May, they had their launch events, their gender action plan. Their gender action plan currently is very binary. So it talks a lot about women and girls, and by women and girls, I mean cisgender women and girls, those who were born women and girls. And very little around any other gender. So it makes no mention really of men and masculinities or boys. It makes no mention of any kind of gender or sexual minorities. And I will be advocating for whatever the next iteration of that gender action plan is, for it to be more inclusive. Because I think what tends to be ignored is, yes, there's a focus on women and girls, because women and girls have been historically underrepresented within disaster risk reduction policy and practice. So there is an imbalance there that needs to be corrected, and it absolutely does. And I 100% support that, and I have worked on that over 14 years. But with that focus, with that very streamlined focus, we end up missing out on all the other gender aspects that a disaster encounters, or people in a disaster encounter. So, for example, a man is much more likely to be expected to act as a rescuer or a put themselves at risk to save another member of their family or to save a community member, etc., because of their gender. There is an elevated expectation of men to be emergency responders or to lead the community in some way that's more risky for them. Transgender people, for example, they aren't really explored within the Gender Action Plan, and as we've discussed during this podcast so far, transgender people have higher rates of domestic and sexual violence than their cisgender counterparts. They're also more economically vulnerable in the aftermath of disaster. They're also more at risk of experiencing domestic abuse, etc. So what I would like to see by the end of this global platform is a better understanding and a more widely understood consideration of how gender isn't just women and girls. Gender is a diverse spectrum, and we should, as disaster risk reduction and disaster risk management professionals, be willing to consider that and research how we can better improve our own systems to ensure that those forgotten genders, whether that be men and masculinities or transgender folk or non-binary folk, etc., how we can better provide for them in the aftermath of disaster.
So finally, just wanted to give you the opportunity to talk about your 2 conferences you're hosting the next couple of weeks, and how can people, get involved with these conferences?
Yeah, thank you. So the first conference is the No Natural Disasters Conference. This is the second conference that we've had. The first one was back in 2022 in London, and this one will be held on Saturday the 7th in Geneva. And this conference, for those of you who don't know, the No Natural Disasters Conference campaign is a campaign that's been set up to really try and change people from using natural to describe disasters. So the term natural disaster is bad in our opinion. It shifts kind of the blame away from the decisions we make as society and puts that blame on nature, the hazard, as opposed to the disaster itself. So what we want to see within the No Natural Disasters campaign is a better understanding of how disasters are caused, the planning and policy decisions that go into elevate risk and exposure of communities. And this conference is an opportunity for us to get together to discuss how the campaign is progressing, what changes are needed to make that campaign more impactful, and really just to talk around how the term natural disaster is very problematic and has a negative impact on DRR as a whole. My second conference that I'm organising is the Gender and Sexual Minorities in DRR conference, and that's happening on the 11th of June. That's entirely online, and that conference really discusses what we've been talking about here on the podcast. It's very focused on gender and sexual minorities in DRR. So we're going to look at things as diverse as how data collection ignores gender and sexual minorities, or look at domestic violence in the aftermath of disaster for those who are of a diverse sexuality or gender. So it's very, very centered on this particular discussion. Both conferences are free of charge. You can join for free, and the best way to do so is to visit my website drrdynamics.com and register on the events page, and there's a link to both of those conferences on the event page. So yes, please do register if you're listening before the conference happens. For those of you who can't join, the No Natural Disasters Conference will be recorded, and certain parts of the Gender and Sexual Minorities Conference will also be recorded.
And we'll also put a link to the registration below these videos and on Spotify as well. And that leaves me to say thank you, Kevin, for a very engaging conversation today.
No, thank you so much, both Mark and Harris. It's been a really great, interesting and enjoyable discussion. Thank you.